Hello, welcome to the Cut Hypertension online volunteer training. What is hypertension? Hypertension is a chronic medical condition in which the blood pressure in the arteries is consistently elevated. Why is this important? Hypertension makes the heart work harder and damages blood vessels, so it increases the risk of cardiovascular disease, including heart attack, heart failure, stroke, aneurysm, and even kidney disease and kidney failure. It causes about 1,000 deaths each day. Some important facts about hypertension. 1 in 3 American adults have hypertension. Of that, 1 in 5 don't even really know. Hypertension is higher among African American adults, consisting of about 43 to 46%. By the age of 55, 1 in 2 adults will have hypertension. Only 52% of people with hypertension have it under control. It costs U.S. about $46 billion each year in healthcare costs and medications and missed work to cover hypertension. Risk factors for hypertension. Diabetes is a major risk factor for hypertension. Behaviors such as high sodium diet, physical inactivity, obesity, excessive alcohol intake, or tobacco usage are also risk factors for the condition. Age is also a risk factor for hypertension. The older you become, the higher your risk of developing the disease. Genetic factors also play a role. Lastly, chronic stress due to frequent engagement of the fight or flight response is also a major risk factor for hypertension. So why screen for hypertension? Hypertension oftentimes have no symptoms and thus known as the silent killer. Screening is easy, safe, cost-effective, and treatment is widely available and affordable. What do the numbers mean? The top number is the systolic, which is the pressure in the arteries when the heart beats. The bottom number is the diastolic, which is the pressure in the arteries when the heart rests. How high is too high? Both numbers are very important. The goal depends on the individual's age or whether they have a disease such as diabetes or chronic kidney disease. Typically, a high blood pressure screening is a systolic pressure greater than 140 and a diastolic pressure greater than 90. The Cut Hypertension Program is a community outreach program for African American or Black men that began in 2014. It was modeled after a similar effort that was done in Philadelphia. It consists of an interprofessional team of health students such as medical, nursing, public health, and pre-med that partner with barbershops to provide blood pressure screenings as well as educate and counsel barbers and patrons. Currently, we partner with 3 local Metro Atlanta barbershops, including Getting Ahead Barbershop, Fade Away Cuts Barbershop, and Faith Barbershop. The objectives of the Cut Hypertension program is to raise awareness of hypertension, to screen for patrons' blood pressure, to provide basic health education and coaching about the importance of controlling blood pressure and about lifestyle factors that influence blood pressure. Lastly, is to facilitate connection with local primary care providers, including free and sliding scale clinics that can serve the underinsured. Visiting the barbershops. Typically, we take 3 volunteers per visit, including 1 barbershop lead who serves as a liaison between the barbers and the hypertension chair. We check in with the barbers when we arrive, and we only approach our patrons when we feel that they want their blood pressure screened. We offer these 2 things, education and screening.
For the screening, you will need to measure the person's blood pressure. If you've never measured a blood pressure before, or if you need a quick refresher, please pause this video and watch an instructional video created by the Mayo Clinic before finishing this training video. A link for the video is found at the bottom of the screen. Please copy and paste into a browser to watch the video, and then resume this training video. Before starting as a volunteer, you must also meet with a designated trainee to demonstrate that you can take a blood pressure reading. Additional instruction can be provided at that time if necessary. Once you complete a blood pressure screening, you should provide some education to help the person understand what their blood pressure numbers mean. We have created a brochure to help facilitate this process. The front side of the brochure contains information on what high blood pressure is and what the consequences of having high blood pressure are.
On the back, we have some information about low-salt diets and an example of a nutrition label so you can show the patrons and the barbers where to look for the sodium content and give them an idea of how much sodium is too much in food they might be eating. And finally, there's a list of community health centers where people who might not have access to health care right now, who don't have health insurance, can go to. These are clinics that all offer a kind of sliding scale and hopefully should be affordable for people even if they don't have insurance. And if they are screened as having high blood pressure, a good place for them to go so they can get some care.
Next, let's talk about some do's and don'ts of visiting the barbershop. You do want to answer questions related to hypertension only. Use the pamphlet as a reference to provide education about lifestyle factors that influence blood pressure. Offer to take blood pressure and record it in the log for the patrons. Advise the patrons of any elevated blood pressure reading that you may obtain. Refer patrons to their primary health care provider if they have a consistent high blood pressure. Be friendly and professional. Don't. Do not take blood pressure in someone's arm if they tell you it's used for dialysis or if they have a shunt. Do not diagnose hypertension. Do not address questions about other health conditions. Do not misrepresent age stat. And lastly, do not force or pressure someone to agree to blood pressure screening. Hello, ma'am. How are you today?
I'm okay.
Would you like your blood pressure taken?
I don't know.
Do you know what your blood pressure is?
I don't.
When was the last time you had it taken?
It was probably a few years ago.
Okay, well, I'm here to take free blood pressure screenings, so I think you might want to get it done just so you will have an idea of what your blood pressure is.
Okay.
Okay, great. Thank you. Can you put your phone on for me?
Sure.
Great. My name is Shay.
Nice
What's
to
your
meet
name?
you. I'm Jane.
Jane. Nice to meet you, Jane. I'm here representing a nonprofit student grant organization, and we basically try to raise awareness about improving a healthy life for Georgia citizens through education, advocacy, and community service.
Okay.
And I'm a member of a service called Hypertension, and we're basically trying to raise awareness about hypertension in African American men.
Okay.
Okay. Let me just be. Okay. Okay. Now your blood pressure is a little high.
It is.
And let me give you this pamphlet. This is some information that you can take with you.
Okay.
Basically, a normal blood pressure screening is between a range of 120 over 80. Basically, the 120 is the systolic number.
Okay.
This is the number that the heart, is using to pump blood through your body. And the bottom number is the diastolic, which is the pressure the heart has on the heart when it's filling back up, when it's relaxing. And you want those numbers to be kind of within this range, just to make sure your heart is not overworking. When you have hypertension, it causes your heart to overwork, which leads to other problems. You're in this range right here, 140 over 90. And I suggest you go see a primary care physician, or you go to a CVS pharmacy and get another reading. They have those little machines where you can stick your arm in and get a reading of your blood pressure. But these are some organs and parts of the body that are negatively affected if you have uncontrolled hypertension, which is also called high blood pressure. It can cause you to have blurred vision or even go blind. It can also affect your kidney function, and it also can affect your heart and may cause you to have a heart attack or stroke. Now, I'm not sure, do you smoke?
I do.
Okay, well, smoking has been known to be a major risk factor for increased hypertension or increased blood pressure. And I would recommend you slow down on the cigarettes, but also some things you can do is modify your diet by decreasing your salt intake and exercising. On the back is a nutritional label. Now, we put this on here so you can have an idea when you go grocery shopping of how much sodium, also known as salt, intake you're having every day. And make sure you're not just looking at the number right here. You have to look at the serving because this is per serving. So if there's 2 servings per container, then that means you multiply that number by 2. And that's a lot of sodium if you do that every time you eat something. So just think about it. A lot of us are not conscious of how much sodium we're taking in every day.
So sodium is the same thing as salt?
Sodium and salt are the same thing, yes.
Okay.
Okay. Also, these are some resources in case you don't have insurance. I'm not sure if you do or no.
I don't.
Okay.
I don't
well,
have a doctor either.
Okay, so these are some sliding scale clinics. Basically, you can go and get treated for a reduced rate or sometimes no rate at all. But make sure you call them before going to make sure to see what documents you need to bring with you in order to be seen.
Okay.
You can take this with you.
Thank you.
I thank you for allowing me to take your blood pressure today, and
Thank
I
you for checking
hope
me
that
out.
you do make sure you go and get another reading and check that out.
Okay.
Enjoy the rest of your day.
Nice to meet you.
Nice to meet you too.
We have some forms that we online keep track of how many patrons we've screened and referred. And these are really important for us to keep on top of. Make sure you fill it out as soon as you are done or during your volunteer session, because it helps us keep track of how well we're doing, how we can improve in the future, and also apply for funding. It's also great if you can help the patrons keep track of their hypertension, of their blood pressure, as much as you can by filling it out if they have those packets that they keep track of it in. And in general, if you have ideas on how we can better monitor and evaluate this program, then share them, because this is definitely an area where we're trying to improve and work on in the future.
To get involved with the Cut Hypertension program, complete and certify online training, contact Shay, Cut Hypertension Lead, to get any questions answered and arrange an in-person sign-off, sign the liability waiver form, practice taking blood pressure, and be signed off by a designated trainee, and lastly, sign up for the date and barbershop of interest. Thank you for viewing the online Cut Hypertension training, and we look forward to you joining our team.